Welcome back to Healthy Life. Our subject for this segment is inhalers, and our guest is Dr. Hale Yarmohammadi, who is an allergist at the Beth Israel Medical Center in New York. Thanks for joining us for the program.
Thank you.
I'm going to ask you to begin by just giving us a brief idea of the range of diseases that are sometimes and often treated with inhalers, and the range of various inhalers that are available.
There are different diseases, mainly upper respiratory diseases, that need inhalers, such as asthma, COPD, emphysema, diseases as such. And as far as inhalers go, there are multiple inhalers out there, but they're divided into two main groups: the MDIs, or the meter dose inhalers, and the more common ones with a disc, which are the powder ones. Using an inhaler, the meter dose inhaler, has a different technique. The technique you want to use when using an inhaler as such is you want to take the cap off, shake it well. Very important to shake it well before you use it. Put your mouth around the inhaler, the mouthpiece. Sometimes we tell patients to take a few deep breaths before they do that. Other times you want to shake it, put your mouth around it, take a deep breath in. You want to definitely puff, take the deep breath in, hold your breath. I tell my patients 10 seconds. You count to 10 seconds with them and you breathe it out. It's very important to do it the right way because you're not going to take the full medication if you don't do so.
All right, let me stop you and ask what
Go ahead.
The common question often is,
Sure.
which is, in that kind of inhaler, are you taking in a deep breath and holding it and then pulsing in the inhaler, or do you try to suck it in as you're pulsing it in?
No. You put your mouth around the inhaler, you pulse it, then you take a deep breath in. Okay? Which is different than the discus forms of the medication, where you want to put your mouth around the mouthpiece and you suck the medication inside. You take a deep breath in, and it's already prepared.
As it's already prepared.
It's already prepared. So when you're ready to take, for example, the discus form of things, you just need to put your mouth around it and take a deep breath inside. Inhale completely and hold your breath, obviously, for 10 seconds and breathe out through your nose.
Remind us once again of the basic difference of those two.
The basic difference really is with the MDIs, or the meter dose inhalers, you put your mouth around it, you have to squirt. Now, a lot of times, if it's hard for the patient to do that, we give those inhalers with a spacer, which is sort of like a tube. They can put the inhaler at the end of the tube and then squirt the inhaler into the tube and put their mouth in front of the mouthpiece of the tube. A lot of times that's easier because you have the medication inside the tube and the patient takes breaths in and out and they get the medication in.
Okay. And then in contrast with the disc variety, you do what again?
You, first of all, when you open the discus, it's already, there's signs indicating the amount of doses left. When you open it and you click and it's ready to go, you just put your mouth around the mouthpiece and you take a deep breath in. You will feel, usually with these medications, a powdery taste in the mouth as well. And that's why I always tell patients, wash their mouth after they've taken the inhaler. That's another important factor.
As we so often say, a picture, or in this case a demonstration, is worth 1,000 words.
Absolutely.
And so I'm hoping that what you've done and demonstrated will be very helpful to patients. And obviously, if they have questions, they should talk to their doctors or their pharmacists and have them show them what to do.
Absolutely. Absolutely.
Okay, thanks for taking the time to join us this morning. We appreciate it.
Very welcome.